It's really useful to be able to get into and access left and right lung independently. And with some of the physical training we're doing, with some of the breathwork approaches, we're going to do that. So very simply, put your hands on one side of the body, one side of the ribs here, and see if you can breathe into just that side. It's fairly easy, isn't it? Yeah, is it okay? Some people struggle to do it, but mostly it's fairly easy. And the other side. Which side is easier? There'll be one side that's easier. Yeah. Now you've got 3 lobes to the lungs on this side and 2 on this side. So there's 5 lobes altogether. It's not symmetrical because you've got the heart on this side as well in the middle here. All right. So, but accessing those lobes of the lung and seeing if you can come in, access the ribs here. And pulsing the breath really helps. Come in, open up, hold it open, and then release it. And the other side. That's the first part of the practice, getting that asymmetric breathing going on left and right side. Yeah. So doing several breaths, and you can do alternate, left side, right side, or you can do a number of times on each side. Either way is good. And however you're doing it, you're feeling into the front, the side, and the back body as you're breathing. So you're trying to feel the back of the ribs opening as well. And you can play with angling, you can play with the movement of the body to enable that feeling. You have to move the shoulder a little bit to get in there. What you have to do to enable that deeper feeling. Some of the movement work we're doing, like on the Nagas, for example, that kind of movement practice will enable a deeper level of access to that. Another question for you then, number 2 here, all right? Can you breathe into the left side of the lungs and through the left nostril alone? Great. And if you want to check, you just put the finger gently here and close the opposite nostril and breathe out. And the other side. You just put the finger underneath even just to stop the air. And now I find it quite easy to do that, yeah? To get in through one nostril, yeah? On one side of the lungs. Now we know full well from what evidence we've got so far that when you're breathing through one nostril, it's actually switching on the blood flow in the opposite side, yeah? on the cerebral cortex, on the frontal cortex here. Yeah? So when we breathe in through the right side, it's switching blood flow on the left prefrontal cortex and vice versa. So by simply doing this, breathing in through the left side here, I'm switching on blood flow on the right prefrontal cortex, which is spatial awareness. Yeah, it's more connected to the body and emotion. I do it the other side. I'm switching on blood flow to the lateralized, or the linear, logical, mathematical side of my brain. Yeah, so I can do that. So there's lateralized, asymmetric access to the lobes of the lungs, front, side, back, in conjunction with single nostril breathing. Good so far. And now we add in lifting and squeezing one side of the pelvic floor. And we've done this in the physical practice, so we can start to get this asymmetric whole body awareness of breath. So we can do the left side, lift the left side of the pelvic floor up, see if you can access that. Yeah. Breathe into that left side of the lung, open up the front, side, back here, all breathing through the left nostril. Again, finger up if you need it, or not. And breathe out. 4 times like this. And pulsing of the breath, pulsing of the pelvic floor, really brings awareness into those tissues. And when you've done 4, do 4 the other side. See how it is the other side. Pulsing the right side of the pelvic floor. Opening the right ribs, front, side, back, all through the right nostril. Great. If you want to get really tricky with it, what you could do, of course, is you could then squeeze up the left side of the pelvic floor, breathe into the left lobes of the lung through the right nostril. Getting into some gymnastics here, obviously. Yeah, and then breathe out through the right side. Same the other side. So we can cross over the nostrils, and then you could breathe in through one side. Let's go through the right side first. So I'm breathing through the right nostril, and I'm going to come into these lobes of the lung here. And then breathe out through the opposite side. Great. So what we've just covered there is a range of ways of working with asymmetric breathing. Just breathing into the lobes of the lung, that's one. Breathing into the lobes of the lung with one nostril, that's two practices. Breathing into the lobes of the lung through one nostril with one side of the pelvic floor, that's three practices. Yeah. And then breathing down with crossing the nostrils over, that's four practices. Yeah. So we've got, and then we can breathing out through the other side. So you've got 5 different ways you can explore asymmetric breathing here. 5 different ways you can explore asymmetric breathing. And that gives you a lot of versatility and clarity to how you breathe and to a very high level of lung and respiratory function.